The chief of infectious disease for Kaiser Permanente Northwest is sharing the latest on the Omicron variant.
Fox 12 Sarah Hurwitz joins us live in studio with new findings and tips from the doctor if you have COVID symptoms. Sarah?
Well, yeah, we know that there's a high demand for tests right now. With a limited supply and staffing shortages, you might not be able to get that COVID test right away. If that's the case, the doctor says assume that you have the virus.
The Omicron variant is more contagious, but Dr. Katie Scharf, the chief of infectious disease for Kaiser Permanente Northwest, says the messaging around it has not been clear.
What people are hearing is, oh, I don't need to worry. Omicron isn't that bad. But that being said, there are still a lot of vulnerable people who will get very sick with Omicron and require hospitalizations.
Dr. Scharf says while data from the UK and South Africa shows that you're less likely to be hospitalized with Omicron, the healthcare system may still get overwhelmed, which could delay other medical care. And in understanding how this variant spreads, she says there are now studies showing that it is more predominantly localized in the nose and upper airways.
What we're seeing is that may be one of the explanations that there's more mild disease, because upper airways is going to be more of that like upper respiratory infection, cold symptoms, and less of the pneumonia symptoms. The other thing is that if you have really high viral loads in your upper airways, that may explain why it's so contagious, why it's so transmissible, as people are shedding virus, through their nose and mouth.
She says there is a new focus now on a different type of testing.
There's some increased interest in doing throat swabs to improve the sensitivity of the antigen testing.
Dr. Scharf says sensitivity means the test's ability to detect more cases. Right now, she says there's limited supply and staffing shortages, and you might not be able to get that COVID test right away.
What I would say is that, if it's right now, January 5th, and you have cold symptoms, you should, and you can't get a test, you should assume you have COVID, because that's what's endemic right now in our community, and you should isolate as if you have COVID.
And the doctor also says if you're thinking about socializing right now, the question should be, are you boosted? She says immunity wanes and getting a booster improves your protection against the Omicron variant. Reporting live tonight in studio, Sarah Hurwitz, Fox 12 Oregon.